Hi, everybody. Getting a late start, but time to do carpools and cannulas. Super excited to be talking about brows this evening, and I think Dr. Greer should be joining us shortly. Um, so, we're going to talk about brow lift, although I feel like we should be talking about the merits of dry shampoo maybe this evening. Um, let's see. Oh, and we have some people joining us. Just need Dr. Greer. So we're going to talk about the different ways that we do brow lifts and go over the surgical and non-surgical brow lift because it is kind of a hot topic or a popular area to address. And sometimes if you don't address the brows, you notice them afterwards. So that can be an issue as well. So hopefully she is going to join us. Just trying to see who's texting me. Okay, waiting for Dr. Greer. Anyway, so brow lifts. There she is. We'll get started in just 1 second. Here, let's see, get her on. Maybe it's just my lousy internet connection. There you are. Hi.
Hello. How are you?
Good. Sorry I'm late. I was running around. Clinic got out of control. And then,
As it does.
yeah, it does go off the rails sometimes. And then also, then traffic was a beast. I don't know, for no particular reason, like why it's Wednesday. I'm not really sure. But anyway. So, you're doing okay? You survived spring break, and so did I.
Okay, I'm hoping the Wi-Fi is going to hold out back here. I'm in my bedroom, and it wasn't quite as strong. But yeah, my kids had spring break. We were out of town, and then I moved the week we got back because that's fun. So
yeah, moving's fun.
Yeah, love it.
Woo.
Especially right after a vacation. It's very restful.
Yeah, right. I know. I operated every day last week. That was my hi. That was yeah. So I got back from spring break, and then every day I was like, okay, that's a lot.
That is a lot.
Yeah, and then my blessed clinic set up clinic every afternoon, so I was like racing to the next thing. Anyway, so we're gonna talk about brows today, right?
Yes, hopefully I'm like getting my kid logged back into her math homework and my other kid's doing his handwriting homework, and they're only a little bit trying to kill each other. But brow lift in the midst of that sounds fantastic.
Kill my brother.
Ella just said, kill my brother, by the way.
Oh, yeah, we have sibling rivalry at our house as well.
Yes, it happens. I have to say, brow lifts are becoming one of my favorite procedures, and they used to be one of my least favorite.
Yep. Same. Yeah. I think some of it has to do with the technique, which I think we both have changed, right?
Yes, because I started off doing like the big coronal incision or the pretracheal in front of the hairline, and it was just so much work, and scalps bleed a lot, by the way, and they're miserable to work on because they bleed a lot, and it didn't make like a very dramatic improvement for all of that,
right?
Which frustrated me.
So yeah, I was trained and did endoscopic brow lift. So small incisions here, here, and here, and then with the camera go in and kind of elevate everything. But then the actual pull is a little less dramatic than I would think. And you're just really kind of.
Although even with the open, it's not.
You're just tugging, awesome. Yeah, you're just tugging back a little bit and sticking it with either a suture or a screw or a staple or something. And so for the amount of dissection, and honestly, it hurts a lot. I think the patient finds it uncomfortable. Their forehead hurts afterwards when you do an endoscopy. So
interesting. I wonder why. I mean, it's all like you're right above the periosteum, right?
Yeah. I don't know. I thought people just didn't really enjoy it. So
I did the subcutaneous lateral brow lift for a while, which is just skin excision, and it gives a little lift, but skin stretches. So so now I do the lateral brow lift that Andrew Giacono does in New York.
okay.
Because when I bought his facelift book to learn his deep plane facelift technique, I actually had a patient who had called for a consultation with him. She lived in New York, but then she was in town with me, and she's like, yeah, I called for a brow lift at his office and it was $25,000. And I was like, well, I have his book. I'll read the chapter. And it's actually, this is literally our conversation. Hopefully she's on here. She's hilarious. She's like, sounds great. And it worked beautifully.
Oh, well, you'll have to share because I do the sub-Q brow lift.
Yeah. Well, his technique is actually a lot like an endoscopic. So he makes the incision, he only does 2 incisions right over the temporalis muscle. Endoscopic tools in an Alfric retractor to see. Elevates here and releases the arcuate line and the conjoint tendon, which is really the key part. And then just suspends the skin flap up a little higher on the temporalis fascia. And it's beautiful. Like I have actually that patient's before and after pictures are on my Instagram, and there is like a visible 0.5 centimeter lift.
That's awesome.
It is awesome. And she was awake actually too. Yeah.
And and then so you use the endoscope to see what you're lifting or no?
Actually I just use the endoscopic elevators. Yeah, no camera, direct vision.
Right.
Yeah.
Okay. And then what are you securing that lift with?
I use
what suture?
I use Ovicryl.
Oh, okay.
Yeah.
Yeah.
Yeah, and it's nice in the incision's this long.
Right.
And you just have to elevate around so it doesn't bunch up when you lift. But,
right.
And it's like a few interrupted horizontal mattress fluorochromic to close, and you're not like curving the incision around the hairline. Because when we do it in front of the hairline, guys, just so you know, we make it wavy because it's less obvious, but it takes longer to close. And with these, it's just a little straight incision. It's back of the hairline. It hides beautifully.
Nice.
Yeah. It is. It's nice. It's a nice technique. I like it. It's very elegant.
Well, I will have to give that some thought then.
I might be freezing.
I think you're okay.
Okay. Maybe you're freezing, actually. Oh, Ella's giving me a thumbs up.
Oh, she's good.
She's a fan of the lateral brow lift as well.
Oh, yeah. Okay. Well,
it's the preferred technique in kindergarten.
In terms of technique, I have also seen, but have not done, the direct right at the brow.
Yeah, I've seen some.
I don't know. I guess in the right patient, maybe.
Yeah. Some people just have that really sebaceous skin that tends to leave indented scars, though, and I'm always afraid I'm going to get that result.
True. And then I saw somebody, I was considering doing it for somebody, but he ended up waiting, who had a brow lift done elsewhere. And they did a lateral brow lift, direct excision right above the brow, and it healed, and it of course, got the desired lift. But he's a man, so he had this like nice arched brow. And
you don't.
Oh, that's weird looking. So then he needed his medial brow.
So that it was straight and not.
Yeah. So we were talking about doing that, but he was gonna try with botox for a little bit, and then I was like, it might relax too, but I don't know why. I guess that person did. So that's the downside, right, of doing the same operation on everybody, whether or not they're male or female. You don't want the, Bella Hadid eyebrow in a guy. It just weird. And so men's brows
it feminizes
straight across. Yeah. So I think
like mine.
I want yours is not straight across.
Mine are very. Do you see these eyebrows? I need a lateral brow lift. Do a vacation in San Diego.
I'll open that chapter, and then you can come to San Diego. We can do it.
You know what? I'll bring the book. You can read up. It'll be fine. Be a fun weekend. Okay.
Yeah. So did you do the brow lift under just sedation or local, or what did you do for this patient?
The couple of times I've done it, I'll usually give like 2 of Versed and 50 of fentanyl. So they're still wide awake, but they care a little bit less. And obviously I have to numb a little extra above the supratrochlear and supraorbital nerves because that's tender. And I tell them they have to be okay with scraping sounds. I've had a couple people opt to do it under local, and I've had more do it under general, but yeah,
Right.
It's doable.
Cool. Yeah, I think lately the ones I've done have been in combination with a facelift, so
Yeah,
or
so
a
they're under general
stuff, maybe upper and lower lids, and so you're just
Yeah.
gonna be under anyway, so it's fine.
Yes.
Yeah. What about how do you feel about the Botox brow lift? Do you like doing that? Do you use Botox?
I do it, yeah. I mean, I tell people like you're gonna get a millimeter, but it does help, I think, in a lot of people. Although often they'll come in and they'll want their whole forehead frozen, and then they want a brow lift, and then you're explaining like, but the forehead lifts the brow, and if the forehead's not moving,
Yeah. You're not gonna.
yeah.
I
Or
mean, you
those
almost want to like, for certain people, just like Botox right centrally so that when they lift their eyebrow, it goes out. But it looks crazy. Yeah.
Oh yeah, it's the Spock brow. Yeah, it's
right.
like this. It's not a good look. I've also had patients who really hate the horizontal lines, but their brow gets really heavy with Botox. I'm like, let's do a lateral brow lift, and then you can freeze it to your heart's content.
Nice.
And that
true.
works. Yeah. Yeah, because that's the thing. People always think brow lifts are going to smooth the horizontal lines, and like the frontalis muscle, guys, is a really thin sheet of muscle over your whole forehead that stays. Like brow lifts are not going to affect that, but they do let you use as much Botox as you want then without dropping your eyebrow. So
right. Yeah, it's not going to go anywhere. So that's smart. Yeah, I do like the corner brow lift. I usually, even when I do feet, I sneak it up there just so that, it keeps it from pulling down at least.
Yeah.
But yeah, definitely balancing that out with what's going on above the brow. And yeah, that is a hard concept, I think, for people to understand, that as much as we hate forehead wrinkles, the purpose of that muscle that you're paralyzing with Botox is to raise your eyebrows. So if you take it out of commission, then you can't raise your eyebrows. And a lot of us walk around with our brows raised kind of baseline
all the time,
appreciating it. Yeah, because
I notice when I haven't been getting my Dysport regularly, and then I do it, like my eyebrows, suddenly I'm like fighting to raise them when it kicks in. So I must be, very skeptical most of the time.
Yes. Yeah, and you usually get used to it. And it's just nice to find that balanced amount of Botox that you need that lets there be a little bit of movement, but nice smooth forehead, right? So
exactly. Yep, and it's different for everybody because they all have different frontalis muscles. I only get like one little line here and here, and then other people are like a whole row of lines all the way across.
Yeah. I haven't gone without Botox in my forehead so long. I guess mine goes all the way across. It's never fully moving. But yeah, and it's just like a long wavy line across. That's about but yeah, you see people who have like a line across and then it jumps up, right? And then it like almost like a square in the middle of their forehead, like it comes up this way. So I think it's important to pay attention. I'm training my nurse now to do Botox, and we've spent a lot of time like looking at how people's muscle works and what naturally doing, because if you treat everybody the same, then it ends up looking
it does not work. And that's part of why Botox is still fun after being a surgeon for 10 plus years, because everybody's muscles are a little different. And I will actually, for some patients where like they're asymmetric or they've had results they didn't like before, I'll draw marks on with the white eyeliner. I don't know who uses that for eyeliner, but we use it for marking for Botox. And I'll take a picture for their chart, and then we can tweak it. And that helps. Or my nurse injectors will bring a picture of somebody they've marked and be like, okay, is this where do you agree with this? Do I need to make tweaks? So it's a subtle art.
Yeah, for sure. Because otherwise it just, I do find that if somebody has a stronger brow on one side, if it's the first time I'm seeing them, I will put the same amount on both sides just to see, because I think sometimes if you chase it, I don't know, there's
it gets worse.
Yeah, compensatory problem once you paralyze it. Like it takes a while for the face to figure out what's going on. So I usually say, hey, I'm going to start even Steven, and then in 2 weeks, let's see where you're at. And then we can add a little bit or not, depending on how your body responds to not being able to move it. So and always need more.
And that's where I always tell my patients, it's like finding somebody who understands your hair and how to cut it. When you find an injector who gets the results you want, you really have to stick with them, because if you're like Groupon hopping, you're not getting those little tweaks from time to time that make your result consistent and perfect.
Yeah, for sure. Definitely, for sure. So, okay. What's your most, what would you say you do your brow lift in conjunction with the most? What's your most,
probably upper eye lift.
Yeah.
Because there's so many people with extra skin on their upper eyes, and half of it is just their brow is dropped.
Right.
So, yeah, how about you?
Same.
Upper lift, yeah.
Yeah. I mean, and I think a lot of people can do upper lids without doing brow. I think it's an overcall. Like you'll run into, like, I think there's probably people in town who every time somebody comes in for an upper eyelid lift, they're also telling them that they need a brow lift, which maybe they do, maybe they don't. But yeah, there's definitely people who do better with both in combination.
Right.
And then I feel like this was a resident level question, but like, which one do you do first?
Yes, and this is important, people. We always do the brow first, because otherwise you end up not being able to close your eyes because we've taken too much skin off the upper lid, which is not awesome. Yeah. I've
actually been called to the OR for that before, where they did the brow first. It wasn't they weren't plastic surgery residents. I won't.
Unfortunate.
I won't mention what service it was, but anyway, they were doing cosmetic surgery, and so they did the bleph
first,
which I don't know how you take two anyway, and then a brow. So it would still have to be a pretty heavy brow, and you know, it'd have to be a pretty aggressive bleph to really taking a little too much skin, and then now can't close the eyelid. I mean, the answer in that question is to just put the brow back.
Yes, set it back leave it be.
Yeah,
and then
come back
later.
Yeah, but that is so you don't want to you know, you want to make sure the brow position's stable before you start taking eyelid skin.
Yeah, and for the people who are always like, but I don't want to get a brow lift, it will pull your brow down lower just doing a bleph.
Yes.
Ask me how I know. I didn't actually do this, but I saw a patient who had just an upper bleph and needed a brow lift. And like, she saw me in consultation, went somewhere else, got just the bleph, came back, and now her eyebrows way too low.
Oh, because it was pulling it down.
Yep.
That is a bummer.
It is a bummer.
I just had my annual eye exam on Monday, and we were talking about, speaking of eyes and opening of the eyes, which can be a lot of things going on, right? So it can be a heavy brow, and then you're trying to raise your brow and open your eye. But my eye doctor was talking to me about Upteak. Have you seen that? The drops?
I've heard of it. Yeah, is it basically, what is it, an alpha agonist to get your Mueller's muscle to contract and make your eyes look more awake? So it's basically what you would give after Botox creates ptosis.
Right.
Hey, Wyatt, dude, I'm on an Instagram Live. What you need, bud?
There's this show on Netflix about the ship that once was unsinkable, even if a shot it in the
Go watch it. That sounds great. He's telling me about a Netflix show. I'm like, that's critical information at this time. At 9 p.m.
We're not burning the house down. Good. Okay. Moving
on. Yeah. Well, one time I was on a Zoom meeting, and I was like, don't come in unless you're bleeding. Ella comes in, why it's bleeding? I'm like, yeah, but is it a lot? I'm like, okay, then go. The people I'm meeting with, they're like, is everything okay? I'm like, they're fine. They're totally fine.
Everything's good.
It's fine.
I feel like everyone in my house is currently on a screen, so it's only a Christmas miracle that that's even working on live, that I'm not, you know, the bandwidth is still strong enough, right?
I know when I got internet at my new house, I was like, yeah, we need the highest speed. Yeah. So many devices. And now that all the TV stream, like.
100%. Okay, so upteak. So we were talking about it. Yes, it
Right.
opens your eyes. She was just telling me the hilariousness of the conference that she was at where they were, the company was promoting this because it's very temporary. So
Right.
you would have to use it. I can't remember exactly how many hours it lasts, but maybe once or twice a day. Like it's at least once a day. And maybe if you have an event or something that evening, you need to use it again.
Ah.
But it is a good, somebody's like, I switched it.
Nice.
They do not have it in my area. So there. But when it comes, I'm definitely switching over. But thanks. We could have a whole topic on like how internet runs our world.
Yes, it does.
And you're like beholden to your signal. Although nothing, just, I love to talk about Afghanistan. When I was deployed in Afghanistan, the internet would go down whenever it rained, which was a fun little fact because we were in the middle of nowhere. Mine didn't either, but just did. Okay, yeah, I will keep checking. Yeah, it was whatever. Anyway, so the upteak opens up your eyes, and then it's really as far as my optometrist was concerned, it's for people who maybe have eyelid ptosis and are considering surgery, like, is it significant enough for you to do that? And she played around with it. Like, usually everybody's eyes are asymmetrical a little bit, so you can, like, put a drop in the eye that you think is a little bit more closed and see how that affects the other eye, whether you need it in both eyes. I just don't really understand the commercial appeal to the average consumer. That's the part I don't get.
Yeah, I mean, it's not something. I mean,
it's
like
not Botox.
lipstick,
like,
you
I think
notice.
it got
I don't know if I would notice my eyes. Yeah.
I mean, I tried out the drops that they had that were popular for a while. I've forgotten what they're called, that made your eyes brighter and whiter.
Lumigan or something? Was it Lumigan? I don't remember.
I think it was something like that. But I mean, it was fine, but it's like, okay, yay, my eyes look whiter and brighter. Like, I don't know. If that's the one thing that's bothering me, then I am.
You could combine them, and then your eyes will be like glow in the dark,
white and
super
large.
wide.
Okay, well, there's one more eye drop that was available that she said that was getting pushed at the conference, which basically gave you meiosis, so contracted your pupil. This is interesting. So that perhaps you wouldn't need readers temporarily.
Oh, I heard of that. Yeah, I don't get that either.
Yeah, she was wondering at the utility of that as well. So
it's basic. I feel like pharmaceutical companies, they're like, here's a side effect of this. How can we market this?
Yes, how can we? I mean, you should have Latisse was the win, just,
And Viagra. Don't forget Viagra.
That's right.
That was the ultimate win because it was a blood pressure medication, people, and it had an unfortunate side effect.
Right. Yeah. That was probably that. There's Viagra here, and then Latisse.
Latisse immediately below. Yep. And now you've got like Quo, that was made by what's Xiaflex, the collagenase that was used for Dupuytren's contracture, which is it's a contracture of your hand and it dissolves the band. So they're like, oh, maybe we can use this for cellulite. But so far from what I've heard, it's just a whole lot of bruising.
Right. Yes. I feel like the results have been underwhelming. So let's just stick with Viagra and Latisse. And upteak, I guess, if you have a problem. But I think if I had a complication where I dropped someone's, I don't even want to talk about it, but dropped someone's upper eyelid with Botox, and knock on wood, I haven't done that. You can have them use basically nasopharine, drops, decongestant drops. Right. They don't need the upteak. But I do occasionally, so what made me originally start this conversation thread was that occasionally I see people who are coming in for either a brow lift or an upper lid lift, and you notice that one eyelid is like lower than the other, and that's ptosis, which is a whole different problem, and be related to a couple of different things. It can be, just how you were born. It's usually an age-related problem. And I don't do ptosis repair.
I don't either. It's a little more involvement with the upper eyelid anatomy than I'm comfortable with. And it's it's a lot of finesse. I send them all to my friend who's oculoplastics, and she's fabulous.
Right. And so that's what I was saying, was that I do send patients like that to oculoplastics. And so maybe I lose the ability to do their upper bluff. But I think it's important for
Okay.
them to get
Yeah.
their, eyelid ptosis exactly right. A lot of times it involves, hitching the levator where it needs to be if that's a dehiscence. And I have done that in the past, but like I said, I don't do it anymore. But it's your 1 millimeter, 2 millimeters. It's a very precise operation. It needs to be done ideally with the patient awake. I mean, I think that's probably the best way to do it. But also you can do a muellerectomy, which I've never trained on and don't feel comfortable doing. And it's
where they're just like cutting off the back of the eyelid. Yeah, I know. I see the pictures. I'm like, it's like in a clamp. That level of eye surgery freaks me out. Anything in the eyeball, really, back of the eyelid. Yeah, I'll stay on the skin surface.
Yes. So, but I would say that if somebody had a ptosis issue, you could offer them Uptique, just to see if they like the correction or not. And then kind of push them along to somebody who does repair. But yeah, I do try to stay away from that now, because I just saw somebody in her upper lid crease was just weirdly high on one side. So, Sally Coilstein.
Yeah.
So I was like, I'm going to need you to see somebody about that. And we can talk about the other things in the meantime. So that's my two. Yeah. So I guess my moral of the story is that the eyelid, the eyebrow, your forehead muscle are all,
What's not going on?
Yeah. They're all together.
It's very intricate anatomy.
Yeah. And so you can't do things in isolation these days. You really need to pay attention to the whole anatomy of the upper third of your face. So any other tips for brows?
I don't have any. I mean,
what do you
think about microblading? Oh,
that's what I was going to say.
Oh, was it?
Yeah. So let's talk about the actual eyebrow. I think that has been the greatest thing ever to hit the beauty industry or the esthetician industry, because I have my eyebrows microbladed, and it's fantastic. I don't know what I should have done it sooner. Honestly, it's so amazing.
It fades faster, right? It's not like the tattoo ink that would like change colors weirdly, and then you have these like gray eyebrows in your 80s.
So I have there are different styles, and I feel like my person could probably break it down a lot easier, but she did a combination. So microblading does not last as long. They were making little cuts into the skin and then smearing the ink on there. And then there's tattooing, which I think the original tattooing was pretty, crude in terms of what options they have. But now they can do nano brushing and all these different little techniques to kind of create what looks like eyebrows, the individual hairs and whatnot. So I think that, I keep getting like spam texted. I think that, I think that it's probably best to do it in a combination. But yeah, if you're a little bit concerned, maybe do microblading because it won't last as long. But I just trusted my brow girl to do what she thought was best. And she did a combination of different shading techniques, micro shading, and then microblading. And it's been amazing.
They look very natural.
Yeah, I've really been happy, and I don't have to do anything with them. The worst part was, keeping it dry for 7 days.
Ooh,
yeah.
That's tough.
And that's not fun.
No, which it makes me think of talking forehead and eyebrow. So when I used to do skin cancer reconstructions, anything on the forehead, you risk pulling one eyebrow up, and that's something we as plastic surgeons really focus on. I had a lovely patient one time who I was going through the pre-op consent and warning her this. She's like, I just draw them on anyway. I'll draw them on even. Right. It was just, like she had this big defect here. She's like, I'll just draw them on even. It doesn't matter. She had like no eyebrow hair to speak of. She was fabulous.
Oh my God. Yeah, no, I highly recommend it. Despite the 7 day of keeping them dry, it was worth it.
It's doable.
For sure. Yeah. highly recommend. And my sister got it done too in the last year, and she really likes the way it looked too. She went with more microblading, which is probably, hey Quinn, is probably a better way to go. If she usually instantly hates everything she does if it's a big change. Like is one of those people who researches it all, then gets the procedure, and then has instant regret. And you're like, okay. So, but then then she's come around and she likes it. So, but it isn't as long lasting as some of the other techniques. So I think it's a good way to go. Okay, so now my trying to join in. Perfect.
Oh yeah, I've been actually petting my dog with my feet this whole time so that he will stay still. Mm-hmm. He's very happy about it.
We should come up with another topic.
I know. What do you guys want to hear about next time?
I know.
What have we not talked about in a while?
Idea. Yeah. And we can talk about some things. Oh, maybe my sister was listening to me because I just got a text.
She's like, "Don't you talk about my eyebrows on Instagram? I'm watching you."
That's personal. It's protected health information. Facelift. Oh yeah, we can do that. Yeah.
We haven't talked about. Good idea.
I feel like we
Thank you.
About that. That's awesome. Yeah, we can definitely cover that. And soft tissue support. So Quinn might work for a company that does Galatea. We can do that. We'll add that to our list.
Oh, funny.
Yeah.
I use quite a bit of Galaflex.
Dr. Greer is a big fan. Yeah.
I do. In fact, I just did a breast lift with Galaflex and fat grafting on Monday, which was lovely.
Oh yeah, we could talk about soft tissue support and fat grafting at the same time, because I just saw two people today that were told they were told that surgeons didn't do fat transfer cosmetically to the breast, and I'm like, why? I mean, I don't really understand. Yay. And then
so facelift's a good thing to talk about.
Yes. Okay, yeah, let's talk about that. All right, so we'll set that up for a couple weeks from now, and then we will also put Galaflex, soft tissue support, and maybe some fat transfer at the same time. We can talk about fat transfer with the face too.
All good topics. Nice.
Yeah. All right.
Yeah, we can in the badness that can happen.
Oh,
cool.
Yeah.
You too. See you in a couple weeks.
Okay. All right. Bye.